All right, so if you're here, chances are you're a radiology resident staring down the barrel of FRCR Part 1. Well, you're in exactly the right place. Let's just dive right in.
This quote right here, it hits the nail on the head, doesn't it? The problem isn't that you're not willing to work hard. It's that feeling of being completely overwhelmed, right? Like you're drowning in books and resources and you need a map. You need someone to tell you where to go.
And that's exactly what we're going to do. The goal here is simple. We're going to give you that map. By the end of this, you'll have a super clear, actionable blueprint. You'll know what to study and maybe even more importantly, what you can finally give yourself permission to ignore.
Okay, first things first. Let's size up the opponent, You can't win the battle if you don't understand the battlefield. And the key thing to realize is that this isn't just one exam. Nope, it's actually two completely different challenges rolled into one.
And this slide just lays it all out perfectly. You've got two totally different beasts to tackle. On one side, you have the anatomy module. That's all about your eyes. It's a visual memory game. Can you spot that tiny structure on a CT scan? But then on the other side, you have the physics module. That's all about your brain wrapping itself around abstract ideas. And here's the kicker. You have to pass both of them separately. They need completely different approaches.
All right, let's talk anatomy. Here is the single most important mindset shift you need to make. Ready? Forget everything you learned in first-year gross anatomy. Just let it go. This exam is not about that. This is about radiological anatomy. It's about learning to see the body through the lens of a scanner.
So, these four modalities, this is going to be your world for the next few months. CT is king. It's your bread and butter, and it's going to be all over the exam. MRI is right there with it, a very close second. When it comes to X-rays, just zero in on the high-yield stuff. Think chest and MSK. And ultrasound? Honestly, it's about the basics. Just know your major landmarks.
Okay, lean in for this one. If there is one area, just one, that you absolutely, positively cannot skimp on, it is neuroanatomy. I'm serious. It is always the most high yield, it's the most complex, and if you can nail it, you are giving yourself a massive, massive advantage.
And look, what's so great about this is that it shows you there's a method to the madness. They don't just pick these structures out of a hat. There's a reason. Why the circle of Willis? Because it's clinically critical. Why the skull-base foramen? Because knowing those proves you have incredible 3D spatial awareness. So this is exactly where you need to pour your energy.
But of course, it's not all about the brain. You absolutely have to nail your bronchopulmonary segments. And listen to me on this one, the liver segments. You have to know them. Seriously, these are free points on the exam if you just put in the reps. Same deal for the big joints, shoulder, knee, hip, and the key bits of pelvic anatomy.
So, okay, we know what to look at, but that leads to the really big question, right? What are they actually going to ask me?
And honestly, the answer is kind of beautiful in its simplicity. It is a pure test of visual recall. That's it. There are no tricky clinical scenarios, no what-if questions. It is literally, here's an arrow pointing to a thing. Name that thing. That's the whole game. Which means your studying has to be looking at images again and again and again.
All right, deep breath. Let's talk about the elephant in the room, physics. This is the module that trips up so many people, and you know why? It's not because it's impossibly hard. It's because most people study for it completely the wrong way. They try to treat it like an engineering final, and that's just not what it is.
This chart right here, this needs to be your North Star for physics prep. Just look at those numbers. MRI and CT. Together, that's 65% of your exam. So if you're spending, say, half your time on the physics of ultrasound, you are fundamentally mismanaging your most precious resource, which is your time. You gotta focus where the points are.
So drilling down into those big topics, here are the concepts you just have to own. For MRI, it's all about T1 and T2 relaxation, pulse sequences and artifacts. For CT, you need to live and breathe Hounsfield units and image reconstruction. And please, I'm begging you, do not sleep on radiation protection. These are some of the easiest marks you will get on the entire paper.
This slide, this is your key to staying sane. Let me be super clear. You do not need to be able to derive complex mathematical equations, but you do need to understand the concept behind them. You don't need to know the detailed engineering of a CT scanner, but you do need to know how those engineering choices affect the final image. It's all about core concepts and recognizing common MCQ patterns.
Okay, so we've talked a lot about the what. We know what to focus on. Now let's talk about the how. Let's build a simple, actionable game plan that you can literally start using the second this is over.
And here it is. It's not rocket science. 4 simple steps. First, spend time actually understanding the core concepts in physics, especially for MRI and CT. Second, and this is non-negotiable, you have to do practice MCQs every single day. Third, for anatomy, you're just drilling images. Repetition is everything. And fourth, you have to use active recall. Don't just read your notes, quiz yourself, constantly.
And this is basically the wisdom of the crowd, the golden rules from people who've already been there and passed. And you start to see the pattern, right? Practice anatomy images daily. Understand physics. Don't just memorize formulas. Do past questions over and over. It all boils down to consistency over cramming, every single time.
Okay, I want you to look at this number and just burn it into your memory. 3. This number is your secret weapon against the single biggest trap that candidates fall into, which is resource overload.
What does it mean? It means you need exactly 3 things. That's it. 1 good anatomy atlas, 1 clear physics source, and 1 high-quality question bank. Pick them and then master them. Trust me, it is so much better to go through 1 book 3 times than it is to go through 3 books 1 time. Keep it simple.
All right, let's bring this home with what might be the most crucial piece of the puzzle. And it's got nothing to do with anatomy or physics. It's all about your mindset.
I really want this to sink in. This exam is not a test of genius. It is a test of being systematic and being consistent. You don't have to be the smartest person preparing for this exam. You just have to be the most organized. A solid plan that you stick to day in and day out will always beat a disorganized genius who crams at the last minute.
And here's the best part. Just by virtue of being here and getting this blueprint, you are already miles ahead of most people. You have the clarity that other candidates might struggle for weeks or even months to find. You know what to do. You know what to ignore. You know where the finish line is.
So really, there's only one thing left. It's time to act. We've removed the confusion. We've laid out the path. The question isn't, what should I do anymore? The real question is, what's the very first step you're going to take today?